Welcome to This Explainer. Today we're jumping right into an absolutely staggering technological milestone that was recently announced by the Indian Health Ministry. We hear the buzzword digital transformation all the time, but we rarely see it executed on a scale that literally rewrites the rules of a country's national infrastructure. We're looking at the Ayushman Bharat Digital Mission. It's an initiative that has just shattered records and, frankly, set a completely new global benchmark for how a nation manages its citizens' health data. So we're going to unpack the data, figure out how this system actually ticks, and explore what this means not just for India, but for the whole future of global digital healthcare. Let's get into it.
930 million, or 93 crore. To really wrap our heads around the massive scale we're talking about here, imagine the population of entire continents. That is the equivalent of the Ayushman Bharat accounts created so far. We are definitely not talking about a small, localized pilot program here. This is nearly 1 billion human beings who have been successfully onboarded into a unified digital ecosystem. Pulling off this level of adoption, it requires overcoming just immense hurdles in logistics, technology, and, perhaps most importantly, public trust.
But the true shock value actually comes with an even bigger number, 1.05 billion. That represents the astronomical amount of individual health records that have been successfully linked to those accounts. Just think about that for a second. Over 1 billion discrete pieces of medical history, lab results, prescriptions, and doctor's notes, all digitally tethered securely to the correct individual. This isn't just a static list of names. It's a living, breathing database of medical histories that's actively being updated and accessed every single day.
Section 1. The Billion Record Milestone.
The Health Ministry's recent report highlights an unprecedented logistical achievement under this digital mission. What it represents is the establishment of a totally new foundation for digital healthcare. When a nation manages health data on this colossal scale, the primary challenge actually isn't just finding server space to store it all, it's interoperability. It's making sure that a record generated in a tiny rural clinic can be instantly and securely accessed by a specialist in a massive metropolis. Surpassing the 1.05 billion linked records mark proves that the digital architecture underpinning this whole operation is not only functional, but highly resilient.
Section 2. What is Ayushman Bharat?
Let's zoom in a bit. The core concept driving all this is the ABHA, or the Ayushman Bharat Health Account. Basically, this acts as a centralized digital identity. You can think of it like a highly secure digital passport specifically for your health. For decades, one of the absolute biggest frustrations for patients worldwide has been the burden of lugging paper medical records from doctor to doctor, and if you happen to lose a physical file, well, that piece of your medical history is just gone forever. The ABHA was designed to completely solve this by giving every citizen a unique identifier that ties their entire health journey together in one seamless, instantly accessible place.
It's literally a night and day shift. Think about the old way. Physical files, heavily fragmented data stuck in silos across dozens of different clinics, and the constant lingering risk of lost medical histories. Every time you see a new doctor, you're starting from scratch, filling out the exact same clipboard of endless forms. Now, contrast that with the new way, centralized access with instant updates. The second a lab result is generated, bam, it's linked to your ABHA. The next doctor you see has your complete, accurate history right in front of them, completely eliminating the guesswork and dramatically speeding up your care. Section 3. Linking your health data.
Okay, so you might be wondering, how does the system actually manage to link over 1 billion records without just breaking down under its own weight? Well, when we break down this massive infrastructural feat, the end-user experience is surprisingly simple and intuitive. It actually comes down to just a few key steps. First, you create an ABHA ID. Second, you visit any participating healthcare facility. Third, during that visit, your medical history or current treatment is digitized. And fourth, that new digital record is securely linked right back to your centralized account. By keeping the user-facing side super simple while all the complex data routing happens behind the scenes, it encourages really high participation. You don't need to be a tech expert, you just need your ID.
And when we compare the stats, a really vital indicator of success jumps out. The 1.05 billion linked health records already outpaces the 930 million accounts created. Why is that such a big deal? Because it proves there is robust, active usage of the system happening across the nation right now. These aren't just empty ghost accounts that people made once and forgot about. Individuals are actively going to doctors, they're generating new medical records, and those records are successfully being linked to their profiles. The system is highly active and being utilized every single day.
Section 4. Why this matters.
So why does all this actually matter?
This transition matters profoundly for the average person and the healthcare ecosystem as a whole. For starters, it completely eliminates lost medical histories. Imagine a patient arriving unconscious at an emergency room. Under the old system, doctors are flying completely blind. They have no idea about the patient's allergies, past surgeries, or current medications. But by unifying all that fragmented data, this initiative ensures that doctors have immediate access to life-saving information exactly when they need it most. It removes the friction, letting medical professionals focus entirely on treatment rather than tracking down paperwork.
What we are seeing here is not just some boring government database update. It's a fundamental transformation of the everyday healthcare experience for hundreds of millions of people. When a patient in a remote village can have their local health data instantly consulted by a top-tier specialist in a completely different state, you effectively democratize access to quality healthcare insights. The scale here is totally unprecedented, and it proves that digital health equity isn't just a pipe dream, it's an achievable goal when it's backed by robust national infrastructure.
Section 5. The Global Health Future.
Let's pan out for a second, because this scale of digital health integration sets an absolutely massive global precedent. For years, digital health advocates worldwide have been theorizing about the benefits of fully centralized interoperable health identities. But let's be real, many countries have struggled to implement these kinds of systems even for populations of just 20 or 30 million people, getting totally bogged down in logistical nightmares and clunky legacy software. India is proving that national digital infrastructure can work flawlessly even with over 1 billion active data points. It serves as a real-time, working blueprint for how a country can architect a digital health ecosystem from the ground up, handle mind-boggling amounts of traffic securely, and actually improve patient outcomes.
As we wrap up this explainer, I want to leave you with a bit of a provocative thought. Is your country ready for a billion-record digital health system? India has successfully crossed the threshold of 93 core accounts and 1.05 billion linked records. And that forces us to ask some really important questions about digital infrastructure and the future of healthcare where we all live. If a system of this magnitude can be built and utilized successfully to save lives and streamline care, what's holding other nations back from doing the exact same thing? It's a fascinating technological leap for sure, and one that is absolutely going to shape the global health narrative for decades to come. Thanks for joining me today to explore this milestone, and keep questioning how technology can reshape our world.